5, 4, 3, 2, 1.
Hello, everybody, and I'd like to welcome you all to our Outbreak Management Advisory Board, whether you're watching at home afterwards or are taking part in the meeting, that's appreciated. And we've got a broad range of agenda items. So the first thing I'd like to do is just record any welcome and apologies. And I'll ask Tracy to do the apologies first, please.
Thank you, Chair. I have apologies from Anne Coyle at City of York Council, and both Jamila Hussain and Michael Melvin are here on her behalf. We have apologies from Phil Netham at the CCG, Mike Padgham at the Independent Care Group, and John Patterson is substituting. Apologies from Steph Porter at the CCG. There's no official substitute, but James McQuillan is here to give an update as part of agenda item 6. We've got apologies from Sharon Stoltz, and Fiona Phillips is here to substitute. Apologies from Dr. Sally Tyra at the Local Medical Council, and apologies from Lisa Winwood, and Mabs Hussain is substituting. We also have a number of people here that maybe haven't been here before that are just here to present items.
Thank you very much, Tracy. And just to mark a formal welcome to anybody that is new as a member or is presenting a paper. And I know that we might be joined by a couple of others as the meeting goes on as well to different agenda items. And just to formally welcome as well, I think Mabs Hussain, this is the first meeting and still new in post as our new Deputy Chief Constable. So welcome to this group.
Thank you, Chair. Yeah, I don't know how long I'm going to be able to use the new for. It's 4 weeks now, so I've been told I no longer can use that. But thank you for a warm welcome.
So that takes us straight on to agenda item 1, which is any declarations of interest. So I'll just give a couple of seconds in case any board members wish to declare any additional interests. But if there aren't any, we'll swiftly go on to agenda item 2, which is the minutes of our last meeting. So that was held on the 24th of November. And I just would like to check if all board members are happy for us to sign off the minutes, or whether you have any matters arising. So again, I'll give a couple of seconds if there are any matters arising. If not, as normal, I will take that as we're happy to sign off the minutes, unless you shout or raise your virtual hand. So thank you for that. We'll sign off those minutes of the last meeting. Takes us straight through to agenda item 3, which is the presentation and regular slot we have on the current situation in York. And I'll hand straight over to Fiona.
Thank you, Chair. And as usual, we're going to put some slides up just so that you can visually see what we're talking about. So since we last met in November, quite a lot has happened, quite a lot of changes. So if we go on to the first slide and you just get a visual of our epidemic curve, and as you can see to the far right hand side, the huge increase in the number of COVID cases that we had starting really in the first couple of weeks in December, and has only really just started to go down in the last couple of weeks. You can see there, though, we do have the lowest rates in the region, but by far higher than at any other point that we have had in the pandemic so far. Previously, at points in the pandemic where we had case rates of over 100, we would have gone into a national lockdown. Our rate at the moment is 868 per 100,000, and we might see that go up again, and I'll talk a little bit about that. One of the other issues that, just to make people aware of, that you might have heard reported, is that the case rates here at the moment do not include anybody who has had COVID for a second or even maybe a third time. That is going to be addressed at a national level. So on the 31st of January, all of the data will be updated nationally and will include any second, third or fourth infections. So we've done a bit of analysis locally to look at what we think that means for us. So up until about December, the number of secondary infections was about 4% more than the data here. And then from January, that rose to about 10% extra. So we'll see that curve kind of go up, but actually the shape of the curve will probably stay the same. So I just wanted to mention that. So if we go on to the next slide, we can see what's really driving our increase in cases. So by far and away, most cases are in children, and particularly the kind of younger age range, and mostly children in primary school, who are those who have had no vaccination. And then what you see is there's a little spike there in the kind of 30s to 45s, and some of that will be parents, so will be that kind of household transmission from school children into their parents. So if we look then at the next slide, that kind of just makes that a bit clearer, because the 5-year age bands don't quite coincide with primary and secondary school. So what you can see is we had a big increase in secondary school children at the start of term. That stabilized a bit, and then what you see at the start of January, when children went back to school, we saw a really big increase in primary school cases. The other bit there that you can see is the grey line, and we are starting to see, as the university students return, we're starting to see cases in that age group go up as well. So if we just go on to the next slide, which shows the rate in our over 60s population. So fortunately, that has been going down, and we can see it's lower than the England and regional rates. And obviously we monitor that, as the older population are more likely to have more serious consequences. So that's positive that that has been going down. So just then on the next slide, it summarises what I've just said about the cases in school-age children, and then also a little bit there about our residential care settings. So we have had a number of outbreaks in care home settings. The positive of that is that we haven't seen hospital admissions from care home residents, and we haven't had any COVID deaths from care home residents. But what it does mean is that when a care home is in an outbreak situation, they can't accept new admissions, and also different arrangements have to be put in place for family members to be able to visit. So it's often through kind of window visits, so the home is essentially closed, so it has that ongoing impact. So just on then to the next slide, which again really kind of demonstrates, you know, why is it that we saw that massive rise in cases over December, and that was largely due to the Omicron variant. So what we can see now is that pretty much all of the cases of COVID that we have in York are the Omicron variant, and we know that that is a highly transmissible variant of COVID. Just then on to the next slide. So this shows us what's happening in hospital. So we haven't really seen the number of COVID cases in hospital dropping yet. They've been going up steadily, and actually this data here is up to the 21st of January, but did just get the data for today come in, and it's not really changed very much. So we have got a high number of patients in hospital, not the highest it has been. And I think probably the other thing just to say as well, very roughly speaking, about a third of patients admitted to hospital are positive when they're admitted to hospital. About a third test positive shortly after their admission, so they may have been incubating COVID when they were admitted, but they weren't positive at that point. And then another third are catching COVID in hospital. So definitely the third who are catching COVID once they're in hospital are not in hospital for COVID. They went in for something else. And then the ones who are testing positive on admission or shortly after, not all of them are going to be in hospital for COVID. Some of them are in with COVID, as it were. So whilst we do have, high numbers in hospital, they're not all likely to be being treated for COVID. And the numbers in ITU, who are those ones who are more likely to be being treated for COVID as well, that stayed relatively low. Just in terms of what we know about the balance between vaccinated and unvaccinated in hospital, it's roughly around 50-50 of vaccinated and unvaccinated. But what we do know is that the people who are in ITU are more likely to be unvaccinated. Just then on to the next slide to talk a little bit about what we've seen in deaths. And again, this encouragingly shows that we haven't seen, as you can see, in other periods of the pandemic where we had an increase in cases, we had those increases in deaths, and that hasn't been borne out with the incredibly high rates of COVID that we've had in this wave. The deaths have stayed low, so that is another positive. So just go on to the next slide then and talk a little bit about our contact tracing team. So our local contact tracing team really took the brunt of the rise in cases over Christmas. So the number of people that they were successfully contacting went up from an average of around 450 people a week to over 800 over December. And what you can't see on this graph is the black line that sits behind that red peak there. So basically the black line is the cases that are actionable and the red line is the cases that are completed. So what that basically means is they attempted to contact everyone. So they did a fantastic job in attempting to contacting at times around about 1,500 people in a week. What we had to do over that December period, because the numbers were so high, is that we changed our processes a little bit. So things like, instead of trying to contact people 3 times, we only tried 2 times, and we didn't do home visits. So some of that was that people didn't want to engage with us, particularly over the Christmas period, when they were busy doing other things. And you can just see from the next slide as well, just kind of shows this in a slightly different way. One of the things I would say actually is, obviously all contact tracing teams across the country experience this, and actually we still had the highest success rate of contact in the Yorkshire and Humber region, and actually a higher success rate than England as a whole. So I think the contact tracing team did really well there. And then the other thing on the next slide that just want to talk about, which happened over the period since we last met, was the demand for lateral flow tests and symptom-free testing. So this was driven by a number of things, partly by people who wanted to mix over Christmas and see family, and they wanted to test to make sure that it was safe to do that. And then also change in policy around being able to come out of isolation early if you had negative lateral flow tests. So the lines along the bottom, the coloured lines along the bottom, show testing by various groups such as school pupils, NHS staff, etc. And they stayed pretty much the same, but the purple line there is basically everybody else who's doing home testing. And what we saw over December was that tests registered in a week went up from around 18,000 tests a week to about 50,000 tests a week. So it was a massive increase in the number of people testing. And also not to forget that these are the people who go on and register their tests online. We know a lot of people perhaps don't do that, so it's probably even higher. So just over that period, we kept our test sites open. and we were able to offer people assisted tests, and we were also able to give people tests to take home to do home testing, and we kept that offer throughout that whole period. The other thing that we also did is that we supplied critical teams in the council, so things like highways teams, the gritters, people like that who we really needed to keep in work. We were able to make sure that those teams had access to tests. We also supplied other organisations like the police, schools, businesses, etc. So we were extremely busy. But we were able to support lots of people in getting their staff access to tests, and some of that was about enabling people who were off with COVID to be able to come back a bit earlier if they had negative tests. So it was just part of that, keeping everything going, really. So I think that is the last of my slides, and the only thing I just wanted to mention is just around contact tracing and testing. As we know at the moment, the legal duty to isolate if you're a positive with COVID expires in March, and if that policy goes ahead, then obviously we will stand down our local contact tracing team. And also we are only funded at present to support asymptomatic testing until the end of March. So again, that resource is likely to disappear. So I mean, I think over the last 2 years now, we've built up considerable expertise in both testing and contact tracing. And one of the things that we've demonstrated is actually that our local approach worked better than the national approach. So I think if those things disappear completely and we move to the new policy, then that's fine. But if any of those elements remain and it moves to a more of a national model again, I think that would be a concern for us. But quite a few unknowns there, but I just wanted to raise that. Thank you.
Thank you very much, Fiona, for that presentation and an update. And the presentation will get published with the minutes after the meeting, just to confirm that, and open it for any questions or comments, if there are any from colleagues. If not, we're obviously noting all of that information and an update as we then go through the different agenda items. So thank you for that, Fiona. Councillor Kilbane.
Oh, thanks, Chair, and apologies for my late arrival. I was in another meeting, but I don't think you covered this, Fiona. When you said it was 50-50 vaxxed, unvaxxed admissions to hospitals, but more likely to be unvaxxed in ITU. Are there any figures for that?
Yeah, I don't have robust figures. We regularly ask this, and what we get is sort of anecdotal reports back from the hospital, and so that's all I can base it on, I'm afraid.
Thank you very much. So that takes us on to agenda item 4. So this was mental health and the economy report, and James is going to present the report that I know has been included in the agenda pack. James.
Yeah, thank you, Chair. So I'll take the paper as read, but I'll just highlight a few key points with it. Then we can open it for discussion and look at the recommendation. So, if you recall, this report was requested at the last Outbreak Management Group, and it's really to look at the impact of the mental health strain that COVID's brought on the economy, and on what's being done to support that and address that. Now, what we know is that mental health was already a big issue in the economy, with an annual cost nationally of somewhere between 33 and 42 billion. So a huge cost to the economy of mental health issues. But we also know is that across all kind of demographics, that's both people who were already suffering and people who weren't suffering, that it has got worse through COVID. What's worth just noting is that there's quite a large element of self-reporting in mental health. And what we know from the self-reporting is that young adults and women are more likely to kind of report fluctuations in their mental health. However, that might also be, those figures might be a factor of actually men being reluctant to report. from that perspective. So the fact that the official stats show that young adults and women are more impacted doesn't necessarily reflect the true picture from that perspective. What we do know, though, is that the unemployed and those on low incomes are worse affected, are more affected. So if you think about the challenge of deprivation and the gap between those with and without, obviously what it does make it harder and make it worse from that perspective. And in a region where unemployment is relatively low and where we have lots of businesses who are struggling to recruit across a whole different number of sectors, obviously having access to as wide a workforce as we possibly can is absolutely critical. So the more people where we can address this and make sure that we've got as robust and a strong workforce available as possible, it is only good for the businesses that we've got that we know are wanting to grow and expand and recruit from that perspective. On a kind of positive note, I think the one change over the last few years is that quite a lot of economic strategies now reflect the importance of this. So again, there's a number listed in the paper, but the issue around mental health and some of these issues and maximising the potential of the workforce is now well documented and is pulled out. And the reason that's important is once it becomes flagged up within your strategies, it becomes easier to address and attract funding for it, because whenever you're bidding for funding, what you have to do is make that strategic case for why you need that funding. So the fact it's flagged up is really positive. And there have been lots of programs out there delivering, of which some are listed, some supporting people who are out of work to make them employable, some supporting those in work. And also outside of that's the economy side, there's also been a huge amount of work done by the Health and Wellbeing Board and wider around it. So there's been a huge kind of focus on mental health, both from a health perspective, but also from an economy perspective. But one of the challenges we've got is it's not being particularly well joined up in the middle, and therefore there's an opportunity to bring that together, get better value for money, and actually deliver kind of deeper, more sustainable impacts if we're able to do that from that perspective. And in York, you're in a position where your Health and Wellbeing Board has a mental health subgroup, and you published a mental health strategy, which I think was about 2018 to 23, I think the strategy runs. But clearly, as we come out of COVID, it's an opportune time to look at that and look at how we can update that. I think what the opportunity is that there should hopefully be some new funding coming into York and North Yorkshire on the back of a pilot project that was run down in Cornwall, which is specifically focusing on this. And within that funding, there should be some resources which should hopefully enable quite a wide group of partners to both across the health and the economy side to work together to kind of create a more coordinated approach and try and join up some of the health and the economy initiatives to achieve the same outcome, because ultimately we've got the same target of what we want to achieve, albeit different drivers to get there. And really that's the recommendation in the report, is that we kind of reflect that there's been lots of good stuff happening, not necessarily joined up. If we've got this new kind of pilot approach coming into York and North Yorkshire, let's use that to try and join the dots up, so that when we develop future strategies, we do that with a really joined up approach to how we tackle what is a growing and a growing issue in the economy, and an issue that's not going to go away quickly. But on that point, happy to take any questions that anyone's got. I would like to just take the point to thank the Health and Wellbeing team at York for their support in writing this paper as well. So they had a really kind of strong contribution. So hopefully it reflects that as well.
Thank you very much for that, James. And obviously open the item for any questions or comments from colleagues. And equally, just to bring to everybody's attention, paragraph 8.1, where there's a recommendation for us to consider endorsing, which is using the Beacon project that's referenced in paragraph 5.2, that a joint working approach is adopted to ensure that funding and programs are coordinated and use lessons learned. And if we're happy to commit to that, I know that City of York Council officers will speak to the LEP team and the Growth Hub there to develop that joint approach. So just to check when anybody comments if they've got any thoughts on that. Fiona.
Yeah, I firstly, just want to thank James for that paper, and we would be more than happy to support that approach. I think, if there's one thing we've learned during the pandemic, it's that, working in silos doesn't get you the best outcomes, and some of the partnerships that we've kind of forged through the pandemic, we would really want to see them carrying on. And so, yeah, we would be more than happy to work with James and his team around looking at how we can really embed this approach.
Thank you very much. Alison.
James, you might already be aware of our Time to Change project, now called York Ending Stigma, which is people with lived experience trying to remove the stigma of mental health. So they're really keen to engage with employers. So if you're not linked up with them already, James, I think it'd be good to get them involved.
James.
And Alison, I honestly, I don't know whether we are or not, if I'm perfectly honest, but are you the person to join it up?
Yeah,
to?
liaise with me. Yeah.
I know there's a group looking at it, so I'm not sure, but I'll make sure that I join up with you. Thanks, Alison.
Councillor Runciman.
Thank you, Chair. I think what this report very well illustrates is not only that mental health and wellbeing is a priority for the city and the Health and Wellbeing Board, but that interventions can be not expensive. And Lisa's story tells that very well. You don't have to have a heavy intervention that costs a fortune. You just have to have people with knowledge pointing people in the right place, and then hopefully they can get the support they needed and get on with their lives. And thank you, James. I think it's really important what you've said.
Thank you.
Sian.
Thanks, Chair, and thanks, James. I found that very interesting and a very helpful illustration of the challenges that we will all be facing together over the coming years. I just wanted to remind everyone that if people are looking for support around mental health, we have a guide. I've included the details in the chat, but I'm aware that isn't publicly accessible. But on our website, you can find a guide to mental health services in York. There's also wellbeing services in there, so it is wider than mental health. It will connect you with other things that might be useful for your wellbeing. So I think it's just a good time to remind people that that is there and it's a resource for the city to use. And if people are experiencing challenges in finding support, we'd be really interested again in hearing about those, because I think the more we know about what people are hearing, the better we can deal with the challenges they're facing. So please do use us if that's helpful, to encourage people to share their experiences and to share what helps and what doesn't.
Thank you very much for that. I know that we'll include that link that you've included in the minutes that will be published. And I wonder, Eddie, whether similarly CYC could do a tweet alongside the meeting to get some of that information out. That would be great. Thank you very much. And I've also been reminded by Tracy that the conversation that we have here will get reported back to the chair of the Mental Health Partnership as well, so that joining up can take place. Jamila.
Yeah, I equally want to say a really good report, James. I think one of the issues we probably want to do a bit more work around is around men and mental health and the reporting of men and young boys around mental health and mental well-being. Another aspect is around children transitioning out of education, either into higher education or into jobs, and how we can support those, because that's a particular trying time for young people, and how we can sort of incorporate some of that work in the work that you will take forward for James. From an adult social care and children's perspective, would really like to work with you on those few points.
I think that's a really good point, Jubilee. I think we need to almost identify the gaps. There's lots of areas where there's lots of really good support, but let's find these trigger points and like I say, let's make it the accepted norm that whether you're young, old, male or female, it makes no difference. It's good to talk and it's good to be open about this. So completely agree with all your points. Thank you.
Thank you very much, James. And I'm sensing from those that spoke and some nods that we are happy to make that commitment to that joint approach. Again, I can see more nods, but again, I'll give it a couple of seconds. Now is time to tell us if not. Otherwise, we'll read that as agreed, so that James, Fiona, and others can take that forward. Thank you, James, for that report and all the work behind it. At this stage, I'd just like to welcome Zoe to the meeting as well formally as the new Police, Fire and Crime Commissioner. Welcome.
Thank you very much, Councillor Aspin, and apologies I'm running late to your meeting today.
No, good to see you here. Pleased that you can take part. So we'll move on to the next agenda item, which is on vaccination and winter planning. I'm very pleased to be able to to be joined by both Will and Daniel from Nimbus Care for this item, and then also Anita from the City Council will pick up some of those issues around vaccine inequality. So I think I'm handing over to Daniel. I was going to say Will first, but Daniel, you're unmuted. So Will or Daniel, over to you.
I think it's myself, Councillor, who will be presenting the presentation in paper, so I'll lead off. And Daniel's obviously going to cover any questions that may be asked, as well as Anita at the end. So thank you everyone for coming today. Okay, I can see you're sharing it, brilliant. So what I wanted to just quickly cover off was where we're up to at this point. So the expansion of eligibility criteria to cover the whole population for booster programme. Also the second doses for 12 to 15s that we're picking up in schools, and also booster for 16, 17-year-olds. That's recent changes in the programme. Next slide. Possibly you control. Yes, you are. Thank you. Okay, so recent successes on the programme have been the booster drive in the lead up to Christmas. You can see here from the graph that a huge uptick in activity in the lead up to the Christmas period. That was all made possible by system-wide partners. As a peak, we did 8,800 doses in a single day across the Vale of York. All of that made possible by the CCG, the ICS, also volunteer workforces, our member partner practices, and also community pharmacies. And we continue to see increased coverage on our patch from the commissioning of community pharmacies, pop-up clinics as well. All of these things have helped contribute to a fantastic uptake in numbers. Next slide, please. So you can see here from the data that we're looking at some really good numbers for first doses. We're at 90% uptake on some of our key cohorts. And the reason that's so important, I think, is because those vulnerable cohorts, having 90% uptake is absolutely empirical to make sure that we protect those individuals. And also we can see the booster dose achievement as well for those cohorts is 80% plus. Next slide, please. So some of the challenges that we're looking to try and overcome in the coming months are, as you'd imagine, to do with younger cohorts and uptake in the sort of 40 to 59 and below. We still have really good rates of vaccination, certainly for first doses. You can see there that 83% for that 40 to 49 bracket, and then realistically 70% and above for 18s and over. These are some of the best figures nationally, and the booster dose achievement is following suit as well. And it's great to see that so many people across the city and our patch are coming forwards to receive that vaccination. But clearly there's still more work to be done, and we're looking at that. So next slide, please. And within that, there's a targeted approach that's really important that we know is fundamental. And that's to do with our ward uptake data. And that was presented in the paper, and also you can see here on this slide. Some of those wards we're still looking at 60% first dose uptake for some of those cohorts. And those really are some of our key focus areas for the coming months, where we'll be focusing all of our activity on pop-up clinics, door knocking and leafleting supported by City of York Council, outreach work. We're working very closely with the university. We'll talk a bit more about that in other slides. But we're cognizant of the fact that there's still people out there, a large number of, who are yet to be vaccinated or yet to come forward for vaccination, and certainly in pockets of York where the blanket offer has still yet to really impact those numbers, and we'll definitely be looking at that. So next slide, please. So some of the things we've been doing as part of an ongoing part of the programme, and also new parts of the programme, we continue to use invitations from practices across York. We use direct mailing, text services, like I said, leaflet dropping, to let people know about services coming in their area, and also that they can still access vaccination at Askham Bar at the mass site 7 days a week. and a 12-hour-a-day service. We've recently reintroduced a walk-in offer as well. Due to the volume, we sometimes have to withdraw that offer. It's now been reintroduced and people can walk in for any dose, be that a first, second, third primary, or in some cases, even that fourth dose for those most vulnerable in our local population. The same offer is true for some pharmacy sites across the York, and also at the university, we're doing targeted work where they've reached out to their student population to say, have you been vaccinated? Lots of students coming from foreign countries, they're arriving, they don't have a booster program yet in that country, and they're eligible for vaccination, and we're there and we're offering that vaccination for them. Other things we're doing, we're carrying on our successful pop-ups that we did in the summer last year in the city centre. So there's been York St John pop-ups. There's also going to be clinics at Jorvik in the surgery there. This is all twinned with some of the work we've been doing to reach out to specific vulnerable groups. This includes the homeless, asylum seekers, and also antenatal clinics have been a big success in our patch, in our area, and have been used to demonstrate work that can be done to help drive uptake in pregnant women and also people who've recently given birth. This is all in tandem with tailored clinics we've been running for disability, and also our continued efforts on the housebound groups. I think one of the challenges we have faced, talked about earlier in this meeting, is to do with the case rate in our local population and the delays that that can bring to the vaccination program. So obviously there's a delay between diagnosed COVID positive and being eligible for receiving that vaccination. And that's why we continue to revisit these areas. So certainly schools, for example, receive not only one, but 2 visits. Again, that schools program vital for that uptake. And we again have some of the best uptake, 60% for that group of all the regions in the UK. And that's part of that revisiting, going back, making sure we capture as many people as possible. Next, that's the end of the presentation, if you don't mind. So I'd also quickly like to just talk about flu. We've had, again, one of the biggest uptakes we've ever seen for flu this season. There were some supply issues that hampered early rolling out of the programme, but still we've managed to see numbers far beyond even last year's flu uptake. And we continue to have that offer. And again, as part of that final mop-up, although it's January, we do have a walk-in offer available at the main Askham Bar vaccination site where people who are eligible can attend for a flu vaccination. And I think that's shown the resilience of that permanent offer within York, that asset that residents can access 7 days a week. Thank you, Councillor, and I'd like to just open the floor now to questions for myself, Daniel and Anita.
Thank you very much. Anita, is there something you'd want to cover first?
I think Will's done a really good job going through my list that I've got here just off camera, but a couple of things that we're working with our comms colleagues on is just letting people know that it's not too late to come forward for a first vaccination, then your subsequent vaccinations. This is an evergreen offer. You'll hear that phrase, evergreen. This offer is long-standing. There's no end date to COVID vaccinations. And the other thing is that people can come forward to vaccination sites to have a conversation. If there's an issue that they want to discuss, if they're nervous about vaccination, it might mean that they want to come forward and have that discussion and then subsequently come forward for the vaccination when they've had that discussion. So we want to let people know that it's okay to come and talk about it too. Thank you.
Thank you very much. So I'll open it for any questions or comments. Daniel, did you want to say anything first?
No, I would reiterate that point that Anita made there, that as being increasingly flexible, increasingly supportive is what we want to do. And we spoke today about how we want to avoid the people who might have stigma about, well, can I go now? Will they say, where have you been all this time? Because our favorite dose to give is the first dose to give. So that's what we want to get across, a message to people that come because we'll love having them here.
Thank you very much. Charlie.
Thank you very much, Keith, and thanks very much to Nimbus Care. We had 2 clinics at the university last week. We've got one coming up this week. I think that'll put in total probably about another 1,400 students into that boosted category. But I got a comment really about the 9 to 24 age groups where most university students sit. Our data from our student survey shows that even before those extra 1,400 or so vaccinations, at least 70% were boosted. Now, obviously, most of those boosters happened earlier during December while students were elsewhere outside of York. But it does point, given the vaccination rate in York among that age group, to a really big challenge facing us to get younger people to move ahead and get that booster. And I suspect that becomes all the more difficult as we move beyond Plan B, which might suggest, well, things are fine. So what can we do to get that age group to really take that booster issue as seriously as I think it should?
I think we definitely recognise that age group are more difficult to externally motivate than their internal motivations, and we see them coming often when they've got their plane ticket to go somewhere. But I suppose we can't book them all holidays. What I would like to, we'd like to work with the university to have, perhaps rather than vaccination clinics, which are actually very successful, but we'd be happy to have explanation clinics first, because these are people who, they don't want to come and then be coerced into it. They want to come and listen and then go away and make up their minds. That we'd happily come and do that.
I think there's also the cohort of that age group that are working as well. So we'd like to work with employers to look at how we reach people that have not gone on to further education but have gone into work, because we know that there's a cohort there as well. I mean, we're happy to work, as you've heard, the people that we work with are broad range, and we're very happy to work with anybody where we can reach either this age group and of those people that have not come forward.
Thank you. Michael.
Thanks. It's really just to refer back a bit to Fiona's presentation and the comments about care homes and those kind of settings, and that issue that we haven't seen the levels of serious illness and death in care homes, and really just to kind of thank everyone who's been involved in the vaccination programme and those extremely high rates which have contributed to a situation which we've got in care settings now, where even though we may have significant numbers closed, actually the quality of life and the risk to those individuals is so significantly reduced from how it was previously, and it's just, it's been a fantastic effort, and I think we're seeing the results of that in terms of that extremely vulnerable population. So it really is just to say thank you to everybody who's made the effort, and it's made a real difference to everyone.
Yeah, thanks, Michael, and I'll definitely pass your comments on to the wider team. There's a lot of work that definitely has gone in the background there to make sure that coverage is there. And maybe it's worth adding on that, again, the evergreen offer that we are actually now revisiting care homes in the coming weeks to make sure that we've captured all residents and also staff, where obviously now it's mandatory to be vaccinated to work there. So there's still ongoing work. We recognise that it's a moving feast, and actually we need to keep going back and making sure that we cover all those bases.
Councillor Kilbane.
Thanks, Chair, and thanks for the report and all the work that you're doing. My concern with the report is the wards where we've got low uptake, and this just seems to be the same issue every time we meet. And actually, the figures for Hall Road in the 50% or 58% are really quite shocking, actually. Have we tried, since the last time we met, have we tried anything new? Have we tried to try and get more people in those wards to take up the offer? What is happening to try and improve the rates in those areas? Because as we know, the ill health through COVID is related to wealth inequality as well. And if we've got more people ending up in hospital proportionately who are not vaccinated and then into ITU, then it is disproportionately affecting poor people. And I just got a feeling that, we're going to be seeing the same thing again and again. And I just want to know what we're doing to try and improve uptake in those wards.
Yeah, you're absolutely right in everything you say, Councillor Kilbane, and I don't know if it's anything new. We meet at least once a week. Will and I meet, and others meet, pharmacists meet to look at these very issues and collectively try to come up with new and innovative ideas. We know specifically where the issues is in each ward. We try and it was called at the beginning of the vaccination programme needle to arm. So the pop-up clinics are happening in those areas. People don't have to travel a long distance now to be able to get vaccination. People, as we've heard Will said, they don't have to book online. So you're trying to overcome that any problems with digital and technology. We target those areas with leaflets so that people can read where the nearest clinic is and the times that they're on. Again, trying to circumnavigate that any digital difficulties. Local pharmacies are very proactive in putting comms out to let people know, because again, that's a trusted avenue for people to go down. I've reached out to councillors in those areas to be able to work with them. We're working with community hubs to get that message across for people. If people have got any issues about vaccination, they're able to contact Public Health directly on the Public Health Enquiries inbox, so we can speak to people directly if they've got any concerns about vaccinations, or if they've got any issues, they can let us know. And it's all ideas welcome, really. Again, like I say, it's an evergreen offer for people to come forward. People can come and have a discussion if it's that. We've also got an offer from the COVID marshals that if transport is an issue, we can arrange free transport for people to get to a vaccination site. And like I said, the discussions don't end. We have these discussions every week to try and look at what else can we do. There's something about keeping the issue alive through that door knocking and leaflet dropping in those areas, so that people know that it's almost reminding people that we are thinking about them as well. We've not forgotten about these people that have not come forward yet. The offer is there, and we welcome any ideas, any innovative or different ideas. But we're constantly trying to think of how else we can reach people.
I was just going to come in, thanks Anita, and I think you make a very valid point, Councillor, and like Anita says, we need to try and just chew through this issue that is recurrent realistically. And I suppose there's sort of three categories, it feels like, that these fit into. There's hesitancy, there's convince, and then there's a sort of social change, or rather policy change from the government, which seems to be the three key factors for whether you have a vaccination or not. I think we as a city have ticked off quite firmly the convenience factor, it feels like to me. We've done a lot of, like Anita says, outreach work. We've been in community centres. We've tried to put it on people's doorstep beyond going to their doorstep. The social change element and the sort of government policy element, it's quite clear when you look back through the data historically that when vaccination becomes a mandatory requirement for certain activities, be that travel abroad, which may not be as relevant to some of the cohorts we're talking about here, or to an impact on your daily life, then we do see people come forwards, and we are actually, rather than having that restricted, having that removed. And I'm not saying that that's a position that we hold, but I know what effect that has on our vaccine uptake. And if we were moving into February, let's say, and to be boosted was a key factor in having a vaccine passport, I've no doubt in my mind that we would see a long queue of people outside coming forward for a booster who hadn't yet come forwards. So I think that's one of the other key factors. And then back to the kind of main one, the hesitancy, and a bit like Anita says, I think sometimes what we would really find useful, I think, is if there's anyone, if the councillors out there feel that there is a handle on their local community and understanding about what this hesitancy is, then, like Daniel mentioned about going to universities and doing education clinics, then we really are, all ears. We will consider everything, and would be delighted to work with people on any local initiatives that they think might help drive that uptake and reduce that hesitancy. Because certainly, like I say, convenience doesn't seem to me to be a factor around vaccination. So yeah, I suppose in a sense, what are we doing as well, other than ongoing business as usual? We are doing the door knocking. We do still run the regular offer of those clinics in areas where people identify with us that there's a need, such as the university, for example, with its new influx of students, we try and respond. And I wonder if, yes, perhaps there's a bit of on the ground intel in these communities that would really, really help us to make that uptake even more successful. I suppose the only other thing I was going to talk about on this question is to do with data. And the data is quite difficult at times to interpret. So the whole road walk data, for example, again, is a moving feast. So when we started this program, cohorts 1 to 9 were eligible. And what happens is, as we expand that eligibility criteria, the percentage rate obviously changes. So we've seen that whole row percentage change substantially as more cohorts become eligible through the program. And again, whether you count first doses, second doses, and then a booster dose as fully vaccinated, or if you look at the national statistics, which are often quoted as boosters as a total percentage of the population, rather than those who've come forward for a first and second. So they don't always tell the full story, but like I said, we agree it's a live issue, and we also would like to see that kind of start to change more substantially between obviously these meetings and the weekly meetings that we have.
Thank you very much. Alison.
Yeah, I just wanted to ask, are you working directly with voluntary and community sector organisations who may well have access to these people that you're finding it difficult to reach? Is that something that's already happening? Is that something that we need to perhaps escalate and do more of?
Yeah, we are, Alison. We are working with a lot of voluntary sectors. We are also working with faith leaders as well. So we work through the CCG to try and reach all people, no matter what. But like Will says, all ideas welcome. If we think we've missed something, or something glaring obviously to you that you think, oh, have I missed that? Please come forward. Thank you.
Thank you very much, Charlie.
Thanks, Keith. Well, this is a data interpretation issue, because I'm a bit surprised that the 19 to 24 age group looks as low as it does, given what we know about our students, which is a much higher rate. But the fact that they may have had their vaccinations largely over the break, their third vaccinations largely over the break, when they would have been back at home, and may have done that via home-based records, does that mean we're running the risk of artificially suppressing the rate in that age group if they didn't get vaccinated in their York context?
So no. So I suppose in the instance of university students, then the data can paint a completely different picture. So if those patients who are registered at the university and then also are registered with a local practice, so in this instance, if we take University of York, Unity Health being the university practice, if they are registered with Unity, then that will appear on York's vaccination uptake data. But if, let's say, for example, this student doesn't access any healthcare in the time that they're enrolled, and they're still registered somewhere else, then their vaccination will actually be sort of recording, if you will, on this Vale of York data. It won't appear it will appear somewhere else. It will appear on the national figures. And so that's why actually I know that your team at the University of York have done a lot of work around that data gathering of students directly, because the other kind of element that's missing here is international students sometimes aren't registered, don't have NHS numbers. These people again don't appear, or in some instances they are registered, but they've been vaccinated abroad, and that means that they will appear as having not had a first and second dose potentially, when in actual fact they have. There's a couple of things that are happening to kind of help with that. So some instances, depending on what vaccine type you've had as a student, then will be eligible to have a booster in the UK, and will be reported. So hopefully we might start to see that some of those people in that cohort, you know, the booster rates start to uptick compared to the first doses. And then the second thing is that there's the Overseas Vaccine Validation Service. So we're going to be starting that service, hopefully in York as well, very soon. And that will also help our uptake data, because there are lots of people out there who've had an MHRA approved vaccine, who will now be able to come forward to Askham and have that dose validated and put onto their record. And that will help our data as well, help our data quality. So we actually know what we're working with here in terms of who's vaccinated and who's not. So I guess there's a bit of crossover, but I think ultimately it's kind of as much data as we can gather to get as much intelligence as possible.
Thank you. Sean.
Thanks. Yeah, I know I asked this question at the Health and Wellbeing Board and got a very full answer about the number of pop-ups that are available in the city. And I know, Will, you've covered all of the pop-ups that are available as well, but we still get feedback quite often that people believe that the only option is to go to the Askham Bar vaccination site. So I wonder if there's something about messages in communities that is the only route, that's kind of false advertising really for what is available in the city, and if there's more we can do to encourage people to speak up about the other options that are there. Because I know sometimes if you do go on the vaccination booking site, you are only offered one or two sites in York, but I do think that is something we're told very frequently. Oh, it's 3 miles, and if you live in the centre it's hopeless, and I can't afford a taxi, and we shouldn't have to rely on York Wheels, and they have limited capacity. So I think there's still more we can do about promoting the message that there are a wider range of options, and those can be community-based, local to you. You don't have to travel, and if you're not able to travel, we can find alternatives. So I think it's just something about the communication, the marketing, the messaging about that to people who will struggle to travel.
That's a really good insight, and I thank you for that, Sian. And we can take that directly back. I know Eddie's in the meeting comms, and we can pick that up tomorrow. And look at getting some citywide comms out around that to make sure that people get that message. So I really thank you for that feedback.
And I'm sure, I know we've got the comms update later as well, where Eddie will be speaking, so we could pick it up there as well. Councillor Kilbane.
Thanks, Chair. Just one last quick one from me. Are you surveying people in low uptake wards as to the reasons why they are, what's the phrase we're using, vaccine hesitant? So are you surveying people in those wards as to why they're hesitant, and if you are, what's the most common reason?
We have done some insight work, Councillor Kilbane, and what we found was there weren't really a theme that were outstanding. There were a lot of as many things as there were as many people. Some of the issues being I'm too busy working, it's not a priority for me. There were some people obviously early on in the vaccine programme that felt hesitant because of the issues around, or perceived issues around, fertility and pregnancy. So there weren't one massive thing that we could hang as hat on, as it were, but throughout the comms that we've done over the vaccination period, we've tried to address, well, we have addressed all those themes in our comms that we've put out. And again, some of that's, you know, if you think about the work done in antenatal clinic and with midwives especially to address that, that's been very successful on that front as well. So there were not one outstanding thing really.
Thank you very much. So to thank Will, Daniel and Anita for the presentation, and obviously we'll note all of that information, and I'm sure record the thanks that were given to the programme, and equally pick up those actions in terms of comms and the promotion of opportunities. And I think that offer there to reach out to councillors across the city, I don't know if Anita and your team could coordinate that for any insight or intelligence, or I think would be a really good idea. Thank you very much for that. So that then takes us on to agenda item 6, which is on system pressures. And this was an agenda item to give some colleagues on the call an opportunity to update on some of the pressures that both NHS and social care colleagues are facing at the moment. So I know there are a number of different people that hopefully know that they're giving updates at this stage. And I'm going to go to Lucy first.
Thank you, Chair. So I'm giving an update on behalf of the hospital. At the hospital, we've been experiencing significant pressures throughout December and January. COVID and the Omicron variant has made a perhaps not surprising contribution to this. So as a trust, currently we've got 164 patients with COVID in our hospitals, of which 97 are in York. As Fiona said earlier, the numbers aren't as high as we've seen in previous waves, but from an operational perspective, managing COVID patients and subsequent COVID contacts is challenging because we have to carve out capacity in the form of beds, and this slows down flow within the hospital. And then this in turn means that we've had some, unfortunately, long waits for admissions in the emergency department and long waits for ambulance handovers, which has been a cause for concern. We've also seen high levels of staff absence, not just with sickness, but also the need for people to isolate due to family members being positive for COVID, which has further contributed to the operational pressures. Colleagues in local authorities have had the same capacity and workforce constraints as we do, which has had an impact on the number of people that are sadly delayed with us in hospital who don't have a right to reside and are awaiting discharge to another location. And all of what I've just described means that we've had to postpone some routine planned operations. However, as far as possible, we've been able to sustain emergency and urgent work, including operations and appointments for patients with cancer. And we've also maintained the majority of our day case surgical activity. So whilst the numbers of admissions for COVID are thankfully lower than we've seen previously, the situation I've described does mean that we are continuing to experience significant pressures on the hospital site. Thank you.
Thank you very much, Lucy, for that. And next I'm going to James, who's covering primary care and ambulance services. James.
Hi, thank you, Councillor. Primary care, the latest data we have, which is November, is now delivering more appointments than pre-pandemic, and in fact October and November 21 were historically high numbers of appointments, so very significant work going on there. Primary care is also, as you know, supporting the vaccination programme. It is worth saying that primary care, as is secondary care, it's a people business. The workforce is tired after working relentlessly now for 2 years. And it's probably worth noting that sometimes the public aren't as kind as one might reasonably expect. In terms of system pressure as of now, we've got today, there was one practice at Opal 3 and 4 at Opal 2, largely driven by staff shortages. So that's primary care in a nutshell.
Thank you very much for that. So I'll now move on to Jamila and Michael for an update about adults and children's social care. Michael.
Thanks. Yeah. So in terms of adult social care, I'd say that the response still is really characterised by organisations working really closely together to support one another. In terms of where we have got issues, to escalate those and to make sure that as a system we're trying to resolve those. I think, as Lucy mentioned, the pressure in the hospital, we're acutely aware of that, and that's then reflected in some of the pressure which is being felt in adult social care. So we've put some additional resources in to support that flow out of hospital, and currently we're working with around 50 assessments for discharge a day, whereas previously that would be, before this wave, maybe kind of 15 to 20. So that's some additional social work we've put in there, some additional home care. We've also got some dedicated step-down provision in the city. But clearly that's being hit as well by needing to temporarily close that sometimes because of the issues around infection as well. So that is quite tough. In terms of the things like the independent home care sector, certainly they've got additional pressures which they're facing. I would say that unlike a number of other areas, we haven't had the large-scale handback of care that other areas have experienced. And again, I think that's due down to sort of the council, but also the wider system support around the home care sector in York. And they're currently delivering about 800 additional hours over what the plan was in the council. However, what I'd say is the ability to expand this further is really hampered by the recruitment and retention issues that we have. But again, there is some national and some regional resource which we've got around that, which we'll be using to help the independent sector to make sure that we have what we need there. Elsewhere in adult social care, the good news is that the numbers of people who are waiting for something in the community for adult social care is starting to fall, and that's been consistent over the past couple of months. So that recovery, we can actually start to see that in terms of being able to do more with the population than we previously have. In terms of supporting the pressure in the system around people leaving hospital with COVID, again, we have Peppermill Court, which is up and running again, and that's being used as a sort of a sub-regional resource. So again, being able to work closely with other local authorities and other systems to make sure that mutual support is in place, which is going to see us through. Peppermill Court is being extremely well used at the moment. It really is. As soon as somebody leaves the door, somebody else is in there, and that just feels, it's an example of the pressure in the system. Residential care homes. It was mentioned in an earlier presentation. So the number of homes that are closed due to COVID is falling. So I think today we've got 13 rather than I think the 18 which was mentioned, and that's predominantly around staff testing positive. And it is that although we have much higher numbers of closures than in previous waves, the impact on those is considerably less, and we can see that number hopefully starting to fall, but we don't want to be complacent about that. I think the other area which I would raise in terms of pressure around adult social care is around continued really high demand on mental health services, and so we're still seeing both referrals around mental health to the local authority really high, but also the numbers of people who we haven't previously known before who've got really acute issues, and the use of the Mental Health Act does remain concerningly high. So I think, as a summary, there's a huge amount of effort going on. It really is, it's a system under pressure, but it feels as though we're supporting one another to do what we can with the resources that we have. I don't know if there's anything more, Jamila, you want to add on to that?
Just to, I'll come to children in a minute, but just another positive thing is that we aren't experiencing a high level of staff sickness as we did just before Christmas. So we're seeing a lot more staff back to work. Some of our provider services, their rotas, we've just done a quick look at the business continuity plans and staffing and rotas. A majority of the rotas are now full, so hopefully, Lucy, that will help some of the discharges out of the hospital. And I know there's a MAID event later on next week, so that will also help with some of the work ESIS are doing with the trust. Just going on to children, it's similar theme really. I think within children's services, we are seeing a lot more referrals into our early help, and this is our front door of services where people are contacting, and are mainly around emotional well-being. I'm hesitant to call it all mental health because a lot of it is around stress and anxiety and supporting families. And now we are seeing some families coming who are talking about fears around changes in their money, around poverty, about fuel, and all those things that support people to live healthy in the community. So those referrals are up. Our child protection and children in need referrals are remaining the same, but we have got some really challenging young people in the system at the moment. But equally with workforce, we haven't got any huge gaps in our workforce in children's at the moment. For education, we did work a lot with the schools just before they reopened in January. All schools had COVID measures in place, and what we aren't seeing is high level of absenteeism. But what we are getting back from schools is that a number of children are quite anxious. They're having quite a number of children who are saying that they are stressed coming into school. Higher levels than we did have in October and November, where we thought following wave 2 we would have more children who are experiencing anxiety. But we're finding that now. There are additional services, mental health support workers in there, and we're working with CHUV, but we're just keeping an eye on that. But like I say, we haven't got high level of absenteeism, but we have got a number of children in school that are quite anxious. But we haven't had any high staff sickness within our schools, and we haven't had any schools that have had to close due to staff sickness or any classrooms or full year groups that have been absent from school because of it. We have got a regional COVID group that I am part of, and I think the rest of the schools regionally are very similar to the schools in York at the moment.
Thank you very much. And now to Alison on the community and voluntary sector.
Yeah, I'm going to kick off and then just bring Sian in, who's going to talk about something more specific. So we're seeing the impacts of all these systems pressures on people who I think are the real victims in this. So we're seeing people who have fallen through the net. And I'm hearing some heartbreaking stories of how people are struggling and suffering because of everything that we're hearing that's going on. So there's no blame attributed to anybody, but these are the people that are suffering as a result of all this that's going on. And of course, they end up with us in the voluntary sector because there are long waiting lists, the thresholds have gone up, so people can't get the support that they're waiting for. So maintenance support for people with long-term conditions is very challenged, as we know, so they're not getting the support that they need. So we're hearing some very complex stuff, and we're seeing people who are really struggling. Some very tragic incidents that we're coming across as well. So that's at the far end of everything, is the people that are really suffering in York. We've got the same workforce challenges in the sector as everybody else. So, you know, we've had people off with COVID or isolating or as a result of the booster. So we've got the same challenges as everybody else as well. So I'm just going to pass over to Sian, who's just going to add some more information.
Yeah, I think Alison and I were talking earlier today about the fact that the voluntary and community sector used to be the place that was about early intervention and prevention, but actually the level of need that we're seeing coming through from the community means that a lot of our services are supporting people at a higher level of need, a higher place approaching sort of more the sort of crisis end of the spectrum. So I think that's a big shift as well for the voluntary and community sector in terms of what we're used to dealing with, what we're seeing, and the impact on our workforce of that. I think we were also talking about where we're seeing the impact on people and their concern about what's happening next. So we've had some very specific examples of concerns for people with learning difficulties about services that haven't reopened and the impact on those voluntary sector organisations that are providing support to individuals with learning difficulties, and how able they are to meet those needs in the absence of some of the things they've come to rely on. I don't think any of you will be surprised to hear we've had a lot of feedback from people around dentistry. We've just published another report, but I think we're starting to see that pressure playing out through the system continually. And I think we're hearing from individuals themselves, there's almost an ongoing need to process what they've been through over the past 2 years, really, in doing what they need to survive, but not being able to access the levels of support they need. So I think that's quite an interesting thing to start hearing people talking about, that they themselves are recognizing that they've done what they can, but they're not happy about it, and they are kind of experiencing some issues with the way that they've expressed themselves or the way that they've had to conduct themselves in that period of time, and they're struggling a bit with that. I think we've also heard more nationally through Healthwatch England, but there have been some locally reported cases as well of people who have been on waiting times or have been waiting for operations, and the consequences of that delay in care, and also a misdiagnosis or failure to diagnose because of people doing the best they could during the pandemic, but not offering the same services that they did before. So I think that's what we're hearing from people about the consequences of all this.
Thank you very much. And then we go to John from the Independent Care Group. John.
Yeah, thank you. Apologies once again, Mike isn't with us this evening, but if he was, I think what he would say to you is this is probably the worst period for independent care providers in social care for decades. Not least because staff are difficult to recruit anyway and the workforce struggles, but at this time it's even more difficult to maintain good quality care, safe staffing, because people are experiencing the need to self-isolate, and you know the numbers have gone up dramatically, as we've seen, and we are still dealing with a number of care home outbreaks care home outbreaks, which hope we'll soon see the end of that coming through. But you know, in the meantime, it's a real challenge, I think, for providers, and the consequence of some of that means that whilst we haven't seen a big volume in York, there are a number of domiciliary care providers who are struggling and have had to hand back contracts. And for care homes, the financial burdens just continue to increase. So the use of agency staff has gone up, and that's, you know, more expensive. The cost of fuel and insurances are more expensive. But because of the inability to reopen homes that are suffering from outbreaks, income is down. And so whilst costs are rising, income is falling for many, and it's probably likely that we will see a number of providers fail over the coming months. And we've yet to realise the impact of the mandatory vaccines for NHS and social care staff, and we all hear and read about the numbers of people that will leave, but we've yet to see what truly is on the system. So, you know, lots of complexity at this time, and we really hope that the Make Care Matter campaign that you may have seen some of the adverts on television for will inspire people to come and join the social care workforce. So there is some light at the end of the tunnel, but generally it's quite a grim picture for the sector at this time.
Thank you. And now I'm handing over to Mabs from the police.
Yeah, thank you, Chair. It's a positive story, which I feel a little bit guilty saying after listening to colleagues. You know, we're performing well with regards to business continuity. It's not been without its challenges, but I am the forever optimist and still policing to the optimum level that we need to provide the service. We had the initial, obviously, surge in absences, either through isolation or actual COVID. Our absence rate now is at a steady 6.8% for officers and staff at 5.4%, which is a really good news story for us as North Yorkshire Police, because some forces are seeing absence rates as high as 10%. I think I can put that down to the geography of a force in terms of some of the agility that we've used with regards to the IT solutions and the kit, and allowing people to work from home, and just spreading some resource and having a very careful approach around it. We've got no business critical issues at this time, and long may that continue. And we're trying to get back to more of a recovery business as usual mode now, with staff returning to work where appropriate. And that's it from North Yorkshire Police. Thank you.
Thank you very much to all of the partners for the updates there. Something that board members might like to consider was if those types of updates are useful, perhaps from a different range of partners or organisations each time, and if you think that it is, we could add that to future agendas as well. So if you did have any feedback, if you contacted Tracy after the meeting to say if you thought it was useful or not, and what format that you think it should take, that would be really useful. So that then takes us on to agenda item 7, which is our communications update, and over to Eddie.
Thanks, Chair. You bear with me, I'll share a screen if that's okay. I hope you can now see that. So the first few slides will be familiar to you all. It's just a simple reminder of the framework and the strategy that's been in place from the beginning of the outbreak management communications approach. You are familiar with those, and I won't rehearse them, other than to reaffirm what Anita's already said, which is that particularly in that lead up to Christmas, there were almost daily meetings between us and the public health team, and there are weekly meetings where we look at where the intelligence lies and how we can helpfully respond to what's going on in COVID land, as it were. So you've seen all of this. I think the more important update is perhaps the work that has been done since the last meeting, which was, of course, on the 24th of November. And I've just lost my button. Where's my button gone? And obviously, this follows, I think, a lot of the presentation that Fiona has already given. So it won't be a surprise to discover that significant increases in our activity arose with significant increases in the spread of Omicron, and that was partly driven by a need to reinforce and amplify the government's communication around the beginning of Plan B, but also around managing locally the rises in the spread of the Omicron variant. And so a great deal of work was done in that period leading up to Christmas and into the new year in terms of reinforcing the rules and behaviour that was expected with Plan B. And also, as you're aware, Chair, some specific work around discouraging, under the guidance of the Director of Public Health, particularly gatherings around New Year, and sending out those messages, which dissuaded people from gathering in the city centre. And part of that, as has already been discussed there, has been about amplifying the NHS's messaging. It's been about that constant push in the run-up to Christmas, particularly around vaccines and amplifying that call for boosters. And I think we've seen some success with that, although I will come back to the concerns about particular areas of the city. And obviously amplifying a lot of the work of our partners in that space as well. We have under that maintained the consistent, accurate, timely drumbeat messages that have been a feature of the COVID work now for the best part of 2 years. And again, that's been about some of the things that have already been discussed. So the work around promoting vaccination for pregnant women and new mothers, the work around boosting, the work around, just the stuff that we've seen very locally in York around wearing masks and so on and so forth. So that has continued under the work that we have done since November. And as I've said, a great deal of work working with partners to make sure that particularly NHS and CCG messages have been amplified and have been effective through our channels. To come back to that point though about working more locally, one of the things that we have started doing, and I think Councillor Kilbane asked the question about more innovative behaviours, is that we have moved in recent months to provide much more locally targeted communications, again following the data that we've seen about where some of those lower areas of uptake have been, and so that is something that we've been pleased to support, and certainly something I think that, as Anita has suggested, we will look at again. It is an approach that I have seen work successfully, and I think there is clearly a need to revisit some of the requirements to target locally in those communities. Part of the work, of course, that we also did in the period after Christmas was around both communications around the availability of lateral flow testing, but also the fairly sizable event that you were involved in, Chair, with Sharon and others, which was the Facebook Live Q&A. As you'll see, the reach in terms of where we were a year ago and 18 months ago is significantly down, but is not negligible at this point. So we're still looking to reach nearly 2,000 people, and a significant number of comments and shares and reactions are happening in that space, which I think is a credit to the people who make that work, including you. We continue to deal with COVID through our planned and sometimes reactive media work. We have issued some 53 press releases in the last 2 months, some half of which, 40% of which, were COVID or health related. And in that same period, we had 64 media inquiries, about a third of which were related to COVID. So there is still some interest in COVID as an issue, but as I think we've seen over recent months, that is declining in terms of the level of media interest. And we've talked a little bit about this already. So in terms of what we think looking forward means for us, we will continue, and Fiona and I had this conversation earlier this week, that there is a change coming, particularly towards the end of March. And I think there's something for the board to consider in terms of what the future of this looks like. We will continue with that regular set of communications around the resident business member partners and families newsletters, and we will continue the media work and the social media campaigns. We will focus in the coming weeks on those areas where we still have any leverage, and that particularly is about, as Fiona said, that's particularly around self-isolation and the rules which are pertinent at any given time around self-isolation. And we will continue, I think, to send a consistent message around the wearing of masks, that people can wear masks if they choose to, that we will encourage that in particularly high density environments. But also, as I have said a couple of times, there's also something in that space, and it comes back to something that's been said a little while ago, there's something about just people being kind to each other and respecting the decisions that can be made there. We will, I think, continue to look at Facebook Live as and when that's required, because I'm not certain, as we've heard this evening, that people's uncertainty has necessarily gone, and we might want to think about how we can continue to use what seems to be a relatively successful idea. And we continue to monitor what support is needed to business. That features as part of the weekly conversation. We've obviously been dealing with the changes in rules from tomorrow, I presume. Today, I lost count. And there has been a focus on the vaccinations for young people. The bigger question, I think, is one now which we've started to deal with it, as you'll see from the next couple of slides, which you've seen before. We've started to deal with issues around physical fitness and mental health, and the conversation that Fiona and I have had this week is how we start now to get into that longer term strategy about the comms relationship with public health, which starts to deal in a I hesitate to use the word post-COVID. The pandemic has not gone away. The government's levers have perhaps been removed, but we need to start having a conversation about what comms looks like in terms of that broader sense of recovery and what the recovery issues are. So things like mental health, physical health, the concerns that people have about skills and money and employment, and so Fiona and I, and emotional well-being, for example. Many of the concerns that we've just talked about in terms of mental health of young people are things which need to start featuring as part of a recovery platform in terms of what COVID comms looks like. Fiona and I have started that work. Anita and I have had a conversation with that today about starting to understand what the public health ask is for the next 12 to 24 months, and I think it would be useful to have some feedback from the board, perhaps not now, as to what you think the priorities need to be in terms of that recovery phase. That's me done. Happy to take questions as always. I shall try and stop sharing too.
Thank you very much for that presentation and an update, and open for any questions and comments. Sian.
Yeah, just listening to that, I was reflecting actually on what James McQuillan was saying earlier about primary care and that people aren't being kind and there is an issue around kindness. And I guess for me, there's a question mark around to what extent are we acknowledging a level of compassion fatigue almost across everybody, that this has been a tremendously difficult time. And there has been a lot of stuff that's been very emotional that you've had to go through, that you've had to think about. There's been concern for family members, there's been concern for friends and neighbours. And I wonder if there is a level of exhaustion in terms of feeling kind towards others. I know I don't want to dwell on politics at the moment, but I think there is a level of frustration and anger about behaviour, about how people conduct themselves. So I just I question what we can say about the standards of behaviour we'd like to think we can all aspire to, and how to be kind to each other, and how to get that sense back of right at the start of the pandemic, there was a real sense that we were all in this together. And I think we've lost a lot of that recently. And I wonder how we can bring some of that back, that if we are York and we are here to help each other, how do we exhibit the sorts of kind behaviours for each other that we know make such a difference in dealing with something as terrible as the past 2 years have been.
Thank you very much. I'll come back to Eddie in a little bit. I'll go to James first.
Thank you, Councillor. Just on that kindness part, it's not that everyone is unkind. Lots of people are hugely kind, but some people are at the end of their tether, I would guess, and put the workforce within primary care in a very difficult position.
Thank you, Eddie.
Thanks, Chair. I think that's right on both counts. And James's point, I think, is one that I guess we're all hearing anecdotally, and sometimes if we have, friends and colleagues and family members who work in some of those services, then I'm hearing that what James is reporting is happening, and there is perhaps kindness is not universal, and frustration is becoming a thing. I think Sian's absolutely right, and there is something about so there is already, as I've shown, there is already some work going on in that space, and the work around the Feel Real York campaign, and that sense of driving, of helping people access services and accessing behaviours which are good for them emotionally and in terms of their mental health, is something which we are starting with. But I think it does need to be a greater feature, and I guess Fiona's better placed than I am to talk about that from a public health point of view. But I think we would absolutely be ready to respond to a campaign driven by public health, which started to assist people in that sense of both emotional and mental health and well-being. As I say, I think that's a welcome brief. Certainly, what I know from research done in other places is that there are a number of concerns that individuals in our communities, residents, have expressed as a consequence of the pandemic, and mental health and physical health, skills, money, and employment are often very high amongst them. So that's why I've kind of chosen those. I think there's probably a piece of work to do to understand whether that applies universally in York, whether or not we need to perhaps think about whether there are areas of the city where some of those are of greater concern than others. But to do that piece of work and then build a long-term approach to a kind of recovery, a set of recovery comms, behaviour change driven stuff, outcomes driven stuff, informed by public health and their priorities, I think is probably the right space to be in, and that's something that Fiona and I have promised that we will start to look at over the coming weeks.
Thank you very much. We'll obviously note that update, and equally note those conversations and work that will be going on with partners, which I know will happen. And that takes us through onto agenda item 8. So that's an update from the Universities and Higher Education group, and I'll go to Charlie to introduce this.
Thanks very much. There's a written paper in the pack. I'll just give a few updates. Case rates, first of all. Both universities in the city have seen surges in student cases. York St John peaked early in January. Its students returned to activity earlier, and it's now back again down at December levels. The University of York is currently at, or I hope, past its peak. The transmission is happening in social settings and within households when one student brings it home, as it were. Good evidence from that testing is working. The non-self-isolation rules, whereby you test every day to look at your status, and that's now uncovering cases, which it's good to see the system doing well. Staff rates at both universities very stable. It's kind of a background hum and hasn't changed as student cases have risen, which suggests that it's not happening in settings where students and staff interact, in particular in teaching settings. All of that notwithstanding high vaccination and booster rates. I said before that our survey of students at the University of York shows that 70% have been boosted, and we had another 900 jabs on top of that last week, and we have another day of vaccinations tomorrow. So that's going well, and we'll hope to work with Nimbus to continue that kind of mopping up operation to get the booster levels as high as we possibly can. We have a cautious response, I think, to the end of Plan B, certainly at the University of York, and in particular, given that surge in student cases. We've been discussing this very carefully with Fiona and colleagues. So we are retaining for a period until the 11th of February a strong mask policy. We are prioritising in-person teaching, but encouraging other activity that doesn't absolutely need to happen in person to continue online for that period. Although probably most of our staff were in one way or another exempt from work from home guidance, some were not, and we're encouraging them not to change their pattern of working until the 11th of February. We'll review the situation in early in that week, and we may well change our position at that point. And I have to say that cautious approach to the end of Plan B has got a tremendously positive response. And perhaps it goes to somewhere where Eddie was pointing to just now. I think there is still that sense of collective purpose and collective responsibility, looking out for one another, which is good, I think, to see. Thank you, Keith.
Thank you very much for that. And the report that was submitted as well, which we're noting today. Again, I'll just give a couple of seconds to check that there aren't any particular questions. If not, thank you very much. That takes us through until agenda item 9. So this is just an opportunity to flag if there are any particular agenda items for the next meeting, which is scheduled for the 23rd of March. But if not, you can just get in contact like normal outside of the meeting with any suggestions or feedback on the agenda. We will have the regular items on the current situation, the communications update, the universities and higher education report. We'll ask Steph Porter to bring back a report on vaccination, vaccine inequality and winter planning, and also that offer for system pressure updates if colleagues would welcome the opportunity to give any updates. But if there are any other items, please tell us. So we'll note that. And then agenda item 10 is just to note the dates of the future meetings. Hopefully you'll have in your diaries 23rd of March and the 25th of May. There is a note here just for information that as the COVID outbreak funding finishes from the government on the 31st of March 22, some local authorities are looking to stand down their outbreak management advisory boards at that point. assuming that nothing changes between now and then in terms of the funding or guidance from government. That might mean that the March meeting would be our last, but I think that should be an open discussion at the March meeting, so that we can decide whether we do want it to carry on, in what format, and how it relates to some of the other boards that we have in the city. And similarly, perhaps you could start to think in advance about what you would want, and again can get in touch outside of the meeting or afterwards with that structure. I wonder on that, Fiona, whether you'd got any particular comments or any updates that I haven't mentioned.
Yeah, I mean, I think just in terms of that point that we're just talking about, obviously, you know, this meeting was set up to deliver our outbreak plan, which we had to develop to say what we were going to do with the money. So I guess there's one element of the money's not there, the plan falls away. But then, as you say, and others have said, COVID hasn't gone away and there are still issues, and our community will still have issues that they're dealing with. So I think, yeah, I would really welcome that conversation about, is it this meeting, is it other forums? You know, clearly there will still be issues to address, and what's the best way of doing that. So, you know, whether we have a little bit of thought about how we can structure a really useful conversation around that at the next meeting, I'd really welcome that.
I think that would be good, and it sounds like that would be an agenda item in its own right as well. So in which case, the 23rd of March meeting will happen. We'll then make a decision, obviously, about the currently scheduled 25th of May meeting through that conversation that we have. And then item 11 is any other business. I'm not aware of any, but again, I'll just give a couple of seconds in case there are any indications from colleagues. But if not, just to thank you for your reports, questions, and input tonight. It's much appreciated, and I'll see you all again in March. Thank you.